That's called a seroma, okay? What do you do with that? Usually nothing. People have tried draining them and they fill back up, so you just leave them alone, okay? But if you feel something that feels a little boggy, like this feels hard, and then there's a little give in this area, then all I do is I use my ultrasound and we see if there's a little seroma, and we just follow it. But they almost always dissolve or resolve by themselves, okay? Allergic reaction, is it possible to get an allergic reaction from the medications I gave you? Yes, but it usually happens within 45 minutes. That's why we're going to give it to you 45 minutes before, and then we monitor you. Okay, and as an old trauma surgeon and ER doc, I'm pretty well versed with what allergic reactions are and what we can do for them. Okay, I think that's pretty much everything. Do you have any questions for me right now?
How soon will I be able to get up and walk around?
Good question. How soon will you be able to get up and walk around? When I get through, you'll walk out of here.
Okay.
Okay. Now, everybody, a question that I get is, well, when will I feel like going back to work? Okay. And a lot of that depends on how much fat we take out, how fast you heal, what your pain tolerance is. But I would say the average, after I've done many, many, many of these cases, most people are back at work in 2 days, which is pretty remarkable when you think about it, And by the way, what does the discomfort feel like? It's more like a soreness. It's not a pain like a toothache, okay? So my patients describe it either as a sunburn under the skin or like they did 1,000 sit-ups or ran a marathon. It's a soreness, okay? Mm-hmm. What other questions do you have?
The drainage. How long can I expect the drainage?
Great question. How long does the drainage last? The drainage will last anywhere from 24 to 48 hours, okay? And then that hole closes up, okay? Now, when I had it done on my love handles, I drained for almost 3 days, but I kept teasing them open because I wanted that draining out of there. Now, what you'll see me do is I'm really going to massage that drainage out, because the more we get of that tumescence out, the faster the collapse will occur. Okay, but that's a good question. So we're going to put a gown. Now, the garment that we're going to put on you, okay, there's some controversy on how long you should wear it. Should it be 2 weeks, 6 weeks? I say wear it as long as you can tolerate it. And if you look at it from a mechanical standpoint, it's helping compress the skin and to glue it, okay? What about exercise? Well, think of this as a mechanical problem, okay? If you're exercising, doing something that is causing a shear force that's going to disrupt those little hooks that I told you about, that's a no-no, okay? But things like swimming and walking are great. Is jumping jacks good? No, okay? So anything that causes a shearing force is not good. So if we were doing your stomach, for example, we wouldn't do abdominal crunches, okay? But we could swim, we could walk, okay? We could do upper body stuff, lower body stuff, okay? And I'll give you an exercise sheet for your legs because we want to tone those muscles. When you can exercise comfortably, that's the time to up your exercise routine, okay? So do more reps, do more weights, whatever. But for a couple of weeks, just kind of go easy, and it's important you walk around because I want that drainage to continue to drain. Now, one other thing. If you have bruising, you'll notice that bruising by gravity is going to go downhill, okay? So don't be surprised if you see some black and blue down around your knees or into your calves, okay? Because everything goes downhill. What else?
How long does the procedure take?
The procedure will take me on your inner thighs. It depends on how big the area is. I'm going to go mark you now, and we'll have a much better idea. But I would say overall, once we get started, it should not be longer than an hour, hour and a half. Okay. Anything else? Now, did we go over the pre and post care with you?
Yes.
Okay, good. So we're all set to go. I'm going to have you go back in the room. You've been weighed. We're going to take photographs. I'm going to mark you so I know artistically what we're going to take out. Almost everybody is uneven in one aspect or another. Okay?
Okay, thank you very much.
You all set?
Yes.
Good.